Hi, my name is Dr. Brian Mailing, and I'm going to talk a little bit about exosome therapy today. So exosomes are very small packages that are secreted by cells that contain signaling molecules such as cytokines and growth factors and other peptides. They're available for clinical use from several sources, and it's very important to obtain exosomes from the best source. Our exosomes are obtained from our own cultured Wharton's jelly stem cells that we use for our stem cell therapy. So it's very likely that the exosomes from the cultured Wharton's jelly stem cells contain the strongest regenerative capacity. Essentially, the signaling molecules coming from placental cord tissue would likely have a greater regenerative capacity than exosomes obtained from other cell sources. Some other common exosome cell sources include adult fat and blood cells. So exosomes obtained from these sources would be very unlikely to have the same cytokines, growth factors, and other peptides that the cultured Wharton's jelly cells have, and therefore a tremendously decreased regenerative capacity compared to what we're using. Our stem cells are also completely safe. They're harnessed from our own cultured Wharton's jelly stem cells, which have been tested over many years without any significant complication or morbidity. The dose is also very important. We use an exosome dose of 100 billion exosomes. Other providers I've reviewed typically use a dose of maybe 2 billion exosomes, and probably not from cultured Wharton's jelly stem cells. So our dose is at least 50 times higher, and our cell source is the best. We also use a very sophisticated processing method to ensure safety during storage and high efficacy upon administration. This is another very important aspect of the treatment protocol. Typically, everyone would receive an intravenous infusion of the exosomes to get themselves the best kind of global treatment for the exosome therapy. The exosomes can also be injected intrathecally, although they do cross the blood-brain barrier much better than stem cells do. But to get more of the exosomes into the central nervous system, we can inject them intrathecally. The exosomes can also be injected directly into the joint, such as the knee, hip, or shoulder, to give extra dose of exosomes to the joint. Additionally, we have a new therapy that we're developing where we apply the exosomes topically to the skin, and we use a microneedling or air jet device to push the exosomes into the deeper layers of the skin. This helps significantly improve the appearance of fine lines and wrinkles, and has also been shown to help regenerate hair regrowth. If you have any questions about exosome therapy or would like to schedule a consultation, you can call my office at 201-342-7662. Thank you very much.